Charu Gupta. I'm working as professor in the Amity University, that is in Noida, India. And the topic of my presentation is phytosterols as nutraceutical invention for the cardiovascular diseases. So now, before I come to the phytosterols, I would like to tell about certain facts related to the cardiovascular diseases and the deaths. So it is estimated that around 18 million people died in the year 2016, which represents around 31% of all the global deaths. And out of these, 85% were solely due to the heart attack and stroke. So this is the figure which is being taken from the WHO, and that has been accessed recently in October 2020. And if we come to India, then we see that India ranks number 1 in world for the number of cardiac patients, with around 10% of the population is affected. And WHO expects that heart disease would be the single greatest killer in India. And the highest growth of heart diseases amongst the young individuals. As compared to the earlier studies, this cardiovascular disease was observed in the elderly population, but due to the change in the lifestyles, the ratio of the young population, they have become more susceptible to the attack of these heart attacks and the cardiovascular diseases. So the cost related to the heart disease, it exceeds around $60 billion per year. So it is quite a huge investing cost, and it calls for a urgent action. And every day, around 2,700 people die due to the cardiovascular disease. So this is a fact. If we see the prevalence of the cardiovascular diseases in both the sexes, like male and female, so you can see from the graph that amongst all the age groups, whether it is 20 to 39, 40 to 59, 60 to 79, and above 80 years, the ratio of the disease in men and women are almost the same. Similarly, when we see the CVD burden in India particularly, so the cases have been almost more than doubled from the year 1990 to 2016, and the death rate has also been more than doubled. So this causes an alarming rate for the cardiovascular disease. And the major reason for the coronary heart disease or the cardiovascular diseases, because there is an increase in the blood cholesterol level. And it has been found in the study that if we are able to decrease the blood cholesterol level even by 1%, so that could represent a 3% reduction in the risk of these heart diseases. So this calls for an immediate action, and here the roles of the phytosterols come into the play. Now, phytosterols are basically the large group of the compounds which are present in the plants, and their major role is that they help in lowering the blood cholesterol level. So we can we can have the foods which are enriched in this type of a nutraceutical, and that could have a cholesterol lowering action. So I would be telling you about the various scientific evidences, what is the mode of action, how the phytosterols work, and the other benefit of using these phytosterols are that since they are natural substances, so they don't have any side effects. Now, phytosterols, the discovery of the phytosterols came into existence as early as in the year 1950s. So they naturally occur in plants, and they are soluble in alcohol, and they are structurally and chemically similar to the cholesterol, but they are different from the cholesterol in the structure of the side chains. So phytosterols basically are of two types depending upon the presence of the double bonds. So sterols have the double bonds, whereas stenols have the single bonds. So phytosterols, they are basically produced by the plants, so that because they help in adaptation to the different temperatures. So basically phytosterols, they help in the maintenance of the phospholipid bilayer of the cell membrane. So they help the plant to survive under extreme conditions of temperature in cold and hot areas. So if we see the chemical structure of the phytosterols, so this is the comparison. So you can see that there is a 4-steroid skeleton structure, and a hydroxyl group is present on the 3rd carbon atom, C3. The 4 steroid structures are A, B, C, D, and typically there is a side chain on the C17 carbon atom. And sterols, they have a double bond between the carbon atom C5 and C6. Whereas in the case of stenols, this double bond is absent. So phytosterols, they have two classes. Sterols, that example is cytosterol and camposterol. So these have double bonds. And the stenols, the saturated ones, the examples types are cytostenol and campostenol, and these two have the single bond. So they are saturated compounds. Now, if we see the difference between the phytosterol and cholesterol, phytosterols, like I already told, that they are synthesized by the plants only. So the humans, they depend on their diet only for the consumption of the phytosterol. So humans cannot synthesize them, only the plants synthesize them. Whereas the cholesterol is synthesized by the liver from the acetyl coenzyme A, and it is an important component of the cell. And phytosterol, it helps the plants to maintain the temperature, whereas cholesterol, it helps to maintain the membrane permeability and fluidity. Phytosterol, the major therapeutic importance that is of nutraceutical value is that it helps to lower the bad cholesterol or the low density lipoprotein in blood by up to 10%. Whereas cholesterol, it serves as a precursor for biosynthesis of steroid hormones, bile acids, and vitamin D. Our diet, during the consumption of our diet, we take only 160 to 400 mg per day of the phytosterol. So that is very insufficient for the therapeutic effect. So dietitians and nutritionists, they recommend that in order to have a therapeutic effect, the daily intake should be around 1 to 2 grams. Whereas in the cholesterol, less than 200 mg is being recommended through the diet because the body can also synthesize it. Now, the efficacy of phytosterols in the enriched foods have been confirmed by the various clinical trial studies, and it has been found that the consumption in the diet is very small, that is around 200 to 400 milligram per day. It is very less absorbed in the body, that is less than 1%, and therefore it is not able to exert the therapeutic value or therapeutic effect in the body. So basically, these phytosterols, they reduce the cholesterol level by interfering in the absorption of the cholesterol molecules in the intestine. So there are various modes of action that has been proposed for the working of the phytosterols. First is that it helps in reducing the absorption of the cholesterol because they have a structure similar to the cholesterol. So they compete with the binding site for the bile salts. So they compete with the cholesterol for incorporation into the bile salts, or they also compete with the enterocytes binding sites. The other mode of mechanism that has been suggested is that they precipitate the marginally soluble cholesterol into in the intestine. The third mode of action that has been suggested is that phytosterols, they enhance the cholesterol excretion also back into the intestinal lumen. So there are various transporters which are responsible, like ABCG5 or GA transporters, which help in the excretion of the cholesterol from the intestine. And the other mechanism is that they also prevent the esterification of the free cholesterol. So therefore, the cholesterol is not able to absorb into the body if their esterification does not take place. Now, besides having the cholesterol lowering effects, the phytosterol has been found to exhibit the other functions also, like it has been found to exhibit some anti-cancer properties. Now, because this phytosterol, it inhibits the absorption of the cholesterol. So it has been found in certain research studies that it helps in the inhibiting and binds to the certain steroids which are responsible for the development of the tumor cells growth. So when they don't get the cholesterol, so then they are unable to survive and the tumor cells die. The other function that has been found by the phytosterol is that they help in the regulation of the immune system. Then another function is that they help in the reduction of the prostate glands also, and they also reduce the blood sugar level. That is, they have been found to be useful in the case of the diabetes. Now, these findings have been supported by the various clinical trial studies which has been carried out. Like for the cardiovascular disease, a study was carried out with the persons which are having a family history of the hypercholesteremia. That was, they were having the high cholesterol level and there was a family history problem. So they were allowed to consume the spreads which were enriched with the phytosterol to around 1.8 to 2.8 gram level per day for a period of total 1 to 3 months. So what was the result? It was found that these phytosterols, they help to lower the total cholesterol by 7 to 11%. Then on the studies related to the prostate gland, so it was a 6-month study which was carried out on around 200 men who were showing the symptoms of the enlarged prostate gland, and they were given around 60 milligram per day of this beta cytosterol. So it was found that there was an increase in the urinary flow, there was a decreased post-void residual urine volume as compared to the placebo. So it was found to have a very beneficial effect in the case of the enlarged prostate gland. The third study was carried out in the patients who were suffering from rheumatoid arthritis, and they were given around 2 milligram of sterols per day for a period of 3 months. And it was found that they helped to decrease the inflammation and they in fact calm the overactive immune response, which was a common characteristic clinical feature in the case of rheumatoid arthritis. The other study of phytosterols in the controlling the blood sugar level in the diabetic patients was carried out when the patients, they were given 2 milligram of sterol per day for the period of 6 to 8 months. And cytosterol, which was shown to normalize the blood sugar level and the insulin level, particularly in the type 2 diabetic patients. And it in fact stimulated the release of insulin in presence of non-stimulatory glucose concentrations. It inhibited the enzyme glucose 6-phosphatase. So it was found to act again in the diabetic patients also. Now, in another clinical study, the combination of plant sterols along with the exercise was also tried. So a randomized placebo-controlled trial was carried out to see the synergistic effect of the plant sterols and the exercise. So the patients were given who were suffering from the hypercholesterolemia disease. So they were given around 1.8 gram per day of the plant sterols and along with the exercise for 3 times per week under supervised conditions. So this treatment was given for a total duration of 8 weeks. And it was found that when the combination of plant sterols and exercise, they have altered the blood lipids more favorably than each treatment alone. So there was a decrease in the total bad cholesterol level, LDL cholesterol, whereas you can see from the table that there was an increase in the good cholesterol level, that is the high density lipoprotein cholesterol, and there was a decrease in the total cholesterol. So all these studies suggest that the phytosterols can be a very efficient and a powerful tool as a nutraceutical for treatment of these cardiovascular diseases related to the increase in the cholesterol level. So regarding the safety considerations, phytosterols have been considered to be the safe, and it is one of the most studied substance, particularly, and it has been recognized as a food enriched for the food enrichment by the various organizations like USFDA, FAO, WHO. And although there is a rare phytosterolemia, it is a rare genetic condition. It is a type of a lipid metabolic disorder, which is found only in 1:50 lakh people. So phytosterolemia is actually a lipid disorder where a person can accumulate or absorb the sterols up to 50% level, and they don't excrete it into the bile. So they develop the large, thick xanthomas on the body, which causes the pain, which causes the difficulty in the movement and stiffness in the muscles. But this is a very rare genetic condition. The other advantage of phytosterol is that they have been found neither to cause any mutation nor any teratogenic effects. In fact, the blood level of the fat-soluble vitamins, that is your vitamin A, D, E, and K, they're also not affected. And there was no decrease in the blood carotenoid levels to a clinical significance. And if there is some decrease, even in some cases, so that can be compensated by consuming a diet which is rich in fruits and vegetables. So there was no convincing evidence of an association between the increased level of blood phytosterol and increased cardio heart disease risk. So phytosterols, they are very safe. Now if we see the dietary sources of the phytosterols, so these are naturally occurring sources which are present exclusively in the plants. So these are present particularly in the fruits, vegetables, oils, and nuts. And one can see the phytosterols in the oils. Rice bran is having the richest source of the phytosterol, that is 1055 milligram in 100 per 100 gram, followed by corn, wheat germ oil, flaxseed oil, cottonseed oil, soya bean, and so on. Coming to the vegetables, you can see the beetroot has the highest 25 milligram per 100 gram. Then nuts, cashews, almonds, pecan, pistachios, walnuts, all are having the fair amount of these phytosterols. Fruits like oranges, banana, apple, cherry, peach, and legumes like pea, kidney bean, and broad bean. But the major problem is that although we are naturally consuming these food sources, but the amount of the intake is around 150 to 450 mg per day. And in order to have a therapeutic effect, these phytosterols should be present in at least consumed to be in 2 grams, minimum 1 to 2 grams per day. So in the year 2016, FDA has recommended and has allowed the following food products to enrich with the phytosterols. Particularly the dairy products, they have been found to be an excellent delivery vehicle for these phytosterols. So margarines, salad dressings, beverages, fruits and vegetable juices, cheese, creams, and baked products, mayonnaise, pasta, sauces, puddings, yogurts, snack bars. So all these can be enriched. And in fact, some of these brand and manufacturing companies, they are selling these phytosterol enriched food products, and they are already available in the European market. So like in the spread food product, so they claim that if you consume their 4 slices of the spread, so that will provide you with 3.4 grams of the phytosterol. Similarly, the yogurt drink, if they consume 100 ml of their yogurt drink, so that will also give 3.4 grams. So accordingly, we can easily consume these phytosterol enriched foods in order to have a beneficial therapeutic effect. Now, regarding to the stability during the processing conditions, so phytosterol has been found to be stable up to the temperature of 100 degrees Celsius, because most of the dairy products, they are pasteurized below 100 degrees Celsius. And when the temperature increases above 100 degrees Celsius, so then the oxidation of phytosterols can take place only under the harsh conditions. Otherwise, below 100 degrees Celsius, it is quite stable. And it is microbiologically inert. There is no chances of the recontamination of the product, and it is also stable over the wide range of the pH. So in the European countries, there are a wide variety of food products which are available nowadays, and they claim to be enriched with the phytosterols. Although there are some adverse effects that has been noticed, particularly it has been found not to be nutritionally appropriate for the pregnant and the breastfeeding women and children particularly below the age of 5 years. But the patients who are on the cholesterol lowering medication should only consume these types of enriched products under the medical supervision. Another adverse effect has been found on the alteration of the testosterone metabolism, because it has been found to inhibit this enzyme 5-alpha reductase, which converts testosterone to dihydrotestosterone. So, but these have been found in very limited patients, and high doses could potentially affect the signal transduction, and to some patients it can even cause the slight nausea, indigestion, constipation, and diarrhea. But these are in cases which are in very few less population. There were some drug interactions were also studied for the phytosterol, and the positive effect was that it showed the synergistic activity with the statin therapy. So statin is a normal cholesterol lowering drug which is commonly used, and if a person is having any cholesterol statin, if a patient is on the statin therapy, then he can consume this phytosterol enriched foods, and it has been found to show the synergistic action. So studies have shown that it would lead to an additional reduction of around 7 to 11% in the LDL cholesterol. The negative impact was seen with the consumption of these phytosterols at a dose of 1.5 gram per day, particularly on the fat-soluble vitamin status. So there has been found that there was 10 to 20% reduction in the plasma carotenoid level after short-term and long-term consumption. So these are few of the drug interaction cases on the phytosterol. Now, but the phytosterol more or large, by and large, they are safe and they're safe for consumption, and therefore so many countries, they have come up with the legislation and they have made it mandatory to provide the foods which are enriched with the phytosterol. So you can see they have been made the legislation in USA, Canada, Europe, Australia, China, Japan, India, Indonesia, Singapore, Thailand, Philippines, and Malaysia, and so on. So they have tried to introduce these phytosterol enriched food products in the market. So my final conclusion to this study is that one should follow a healthy eating pattern. One should include a variety of the colorful vegetables, fruits, all the different types of the colored like dark green, red, orange, legumes. Whole fruit should be consumed instead of the juices. Grains should be taken. Fat-free or low-fat dairy products should be taken. Protein foods like your seafood, lean meats, poultry, eggs, legumes. And one should limit the use of the saturated fats or the trans fats, any type of the added sugar or the refined sugar, and the sodium. So if we follow these dietary guidelines, one can have a healthy living. So thank you all. That's all from my side for your patience listening.